Mm-hmm.
And I think also to make that even more complex, some of the metabolic changes that happen during
Mm-hmm.
perimenopause, including weight gain and body composition changes, so weight
Mm-hmm.
redistribution, particularly mid-abdominal weight gain. Women come to me all the time saying that I'm eating the same, I'm working out the same, and my body is changing, and I feel like I can't stop it. And you feel out
Mm-hmm.
of control. So now you're irritable, you're feeling depressed, feeling anxious. Now your body's changing, you're gaining weight, which causes this whole cascade. And especially for women, we tend to, our body and our weight, we're very sensitive to those changes. And so you're just tackling all these things on that they're a struggle. And it's difficult,
Yeah.
and that's why
Yeah.
I love Mary Claire Haver's word, the zone of chaos, because you just feel
Yeah.
chaotic.
Hi, friends. You're listening to Life Intended, a podcast that explores what it means to be true to yourself and live an authentic and purposeful life. I'm your host, Kelley Berry, and each episode of Life Intended explores my guest's version of personal growth, self-discovery, and the pursuit of becoming the best version of themselves. Our conversations are designed so that you can take what you need and incorporate it into your life to live with more intention and authenticity. Whether you're seeking to develop your leadership skills, overcome challenges, or simply live a more fulfilling life, you will find guidance, motivation, and practical strategies to help you navigate your unique journey. Today, I have an expert in a topic I think so many of you are going to find relevant, informative, and interesting, and I can't wait to have this discussion. Kelley Maple is a board-certified family nurse practitioner and the co-founder and chief medical officer of Medical Anti-Aging, a regenerative medicine practice dedicated to helping men and women navigate aging with confidence through tailored hormone, peptide, and aesthetic treatments. She is also the founder of the KM Health Collective, an educational platform dedicated to redefining midlife health for women. An active member of the North American Menopause Society, Kelley is committed to advancing a new standard of menopause care rooted in science, compassion, and personal experience, empowering women to take charge of their well-being through perimenopause and beyond. Welcome, Kelley. I'm really just so excited to have you here and have this conversation.
Thank you, Kelley. I'm so excited to be here also, and this is my favorite topic of discussion, so I'm grateful to be here. Thank you so much for having me as your guest.
Yeah, definitely. Tell us, I know I just mentioned this, we were chatting right before we started recording, and I told Kelley, she helped me prepare for an interview, pointing me towards some resources. And so I told her, now I'm in this topic. I feel like the kid in college who just took a class and I'm like, now I need to change my major because I need to know everything about this topic. So maybe you had the same experience, but how did you get so interested in this topic and kind of really now this is the path that you're on in your career?
Obviously, it's multifactorial things that happen. And I would say, I like to tell this little brief story all the way back to 25, 30 years ago when I was a teenager, early 20s. I remember my parents going and getting their hormone treatments and talking about how great they feel and wanting to age well. And they have this thriving sex life. And now fast forward, they're close to 70 and they're amazing. They're happy, they're healthy, they feel great. And so I would say that was probably the small little flame that started way back then. My mom had been struggling through perimenopause and really struggling, and it was affecting her relationship and affecting us. And she sought help and found a really, I would say at that time, progressive provider who really changed her life. So that was always in the back of my mind. And then I worked as a nurse. I'm a nurse practitioner now, but my career as a nurse began in the CVICU, so cardiovascular intensive care. Did that for about 10 years. And I just became so frustrated with this reactive medical model and seeing especially women suffering with heart disease. Heart disease, just a quick side, is the number one killer of women, not breast cancer, not things, but heart disease. And so during that time in the CVICU, my mind was just going can't we figure something better? Let's figure out a way to prevent these illnesses. So that's what kind of was my catalyst to go to nurse practitioner school and then do my board certification. And then when I started looking for my rotations, I specifically wanted to find a practice that specialized in not totally functional medicine, but just thought outside the box and who offered more than just traditional primary care. So I was so grateful to find a mentor, a nurse practitioner there, and also a doctor who were just so open-minded and were providing hormone care at that time. And I learned, that's where I started. So I did my rotations as a student there, and then they hired me.
Oh, nice.
So yeah, it was so cool. And I got some certifications in hormone replacement therapy. And I just saw the impact it had on my patients' lives, both men and women. But at that time, really the focus was more on just menopausal hormone therapy, not so
Mm-hmm.
much on women in perimenopause. And I really hadn't made that. I was unaware, really, what before menopause, what perimenopause was truly, and
Mm-hmm.
what women were going through until I started going through that myself. And I then really just started doing a deep dive and became passionate on helping women, not just at the menopause transition before, and that's really where all this has come about.
Yeah. So that's awesome. And an interesting like tie to what you experienced and saw through your mom and then kind of like where that has led you. So there's so many layers to this, I know, and you can kind of decide where's the best place for us to start. But can we talk about hormone therapy and kind of like the history of that and what has gone on with that? Can you define perimenopause for us and what that looks like? Because I think that there's just like, you just mentioned being unaware. I think there's just a great unawareness. And I'm 43, like I don't know anything about this either. So talk to us like which one of those things comes first and where's the best place for us to start?
Sure. So I think just some basics of really, let's say, what is menopause and what does that look like? So the average age of menopause in America is 51. Now that can be anywhere, say 45 to 55. That's still considered normal. But what we know and what we're learning more about is that the perimenopause transition can begin even 7 to 10 years before that. So a woman in her late 30s or early 40s can really beginning to experience symptoms of perimenopause. And the reason that this occurs is that, we're born with a finite number of eggs. And once we start ovulating and having our cycle, we go through those eggs pretty rapidly. And as we get closer to this mid 30s, late 30s, early 40s, the quantity and quality of our egg production is declining, and our brain senses that. So what used to be this really nice rhythmic pattern of hormone secretion, and that's led to our menstrual cycle, becomes really, really chaotic. And probably one of the podcasts that I had spoken to, there's an
Mm-hmm.
incredible educator, Dr. Mary Claire Haver, who really coined the term the zone of chaos for
Yes.
perimenopause. And that's exactly what it is. Our brain is sensing something's not right here. I'm giving the same signal to the ovary to make those hormones, and it's not responding the same. What's happening? So those hormonal changes then start causing changes in our metabolism, in our mood, and in a whole host of other things that we start seeing, like I said, sometimes in the late 30s. And women just aren't aware of that. We are in a really incredible time to be a woman in perimenopause because this is becoming, I say perimenopause is having its moment, a long overdue moment, as well as menopause. The Women's Health Initiative study came out in 2002. And at that time, it was a flawed study, which we know now, but at the time came out basically said hormones cause cancer, take all your women off of hormones. So for the next 20 years, the last 20 years after that, really providers became very scared to prescribe hormones for women. Where we're at now, fast forward in the most up to date literature, is that most of the data, we have good data from there that we utilize, but the data that was very scary about hormone therapy has all really been refuted, and we have much better information now than we
Mm-hmm.
did then. But that's how it's kind of like we're coming back around to say, okay, we need to start over and get accurate data and move forward with accuracy instead of the fear that we've had for the last 20 years.
Yeah. Yeah. From my understanding from Dr. Mary Claire, it was like probably the wrong sample used in that study combined with like some really just like inaccurate interpretation of the findings. And
Yep,
so when people went back and looked at it, they realized, what we were told about hormone replacement therapy and why we've not given it is not really accurate. And so
correct.
this whole almost like generation of women who were going through perimenopause and menopause during that time have kind of suffered.
Suffered immensely.
Yeah.
So what happened in the Women's Health Initiative study is that hormone therapy was initiated all on women over the age of 60.
Mm-hmm.
In addition, they were given synthetic estrogen. It was derived from horse urine. and synthetic progestins, right? So our body makes estradiol and our body makes progesterone. Those are body identical or bioidentical hormones. They were given synthetic estrogens and synthetic progestins, in addition to the age being a factor. Where we are now and what we kind of talk about in understanding menopause care is that the initiation of replacing those lost hormones after menopause within the first 5 years of the last menstrual cycle, and then we even go up to those 10 years after the menstrual cycle, is the safest and really best window to reintroduce hormones. So if you just look at those little things right there, age, synthetic estrogen, synthetic progestins, you're starting with a flawed sample in a flawed study, right?
Yeah.
Estrogen has incredible anti-inflammatory effects on the body, on the brain, on the heart, and the blood vessels. But it has that effect when the body is still healthy because it's had estrogen, right? So we've had all this estrogen in our body. If we wait a long time after our last menstrual period where we're no longer making estrogen, we lose some of that anti-inflammatory protective effect. So to then reintroduce it so much later, there's still quite a bit of unknown. We don't see the same protective benefits of that. And so that's where we stand now, is that we've really identified this window of opportunity and safety, really, for women to use estrogen therapy. I tell women all the time, estrogen is something that has been absolutely vital to our functioning since we were basically born, and then especially from the time of puberty on. Estrogen itself is not carcinogenic. It is not something that causes cancer. Estrogen is in our body forever. Why all of a sudden the last menstrual period comes and now estrogen is going to cause cancer? And estrogen levels during pregnancy are sky high, higher than we'd ever give when we're giving hormone therapy. So it's just kind of, I think, a really great time of just getting facts and truth about how our bodies work and about how estrogen in particular functions in our body, so that we can really break that cycle of fear for women.
Yeah. I think one of the things I had never heard and was so enlightening for me is what you're talking about, like all of the protective benefits of estrogen. And you can speak to these more, but like all of the, I guess, the substitutes, I'll say, for estrogen that women are getting when they're not on hormone replacement therapy to address mood, cholesterol, all of these things that estrogen, as I understand it, would be a better option for. So can you talk some about what like heard and kind of give the expert version of that?
Sure. So let's start with, I think that we can kind of take some of the perimenopause symptoms and then talk about them.
Okay, yeah.
And you had mentioned substitutes. And so we see a 40% increase in antidepressant prescription use during women during perimenopause, late 30s, early 40s. SSRI use increases by 40%. And what we know is that absolutely has a connection to a decline in estrogen. Our neurotransmitters are highly sensitive to our sex hormones, meaning all those hormones that our ovaries produce. So, we're kind of thinking like, wow, we've just been putting all these women coming in who are saying, I'm depressed, I'm irritable, I'm anxious, I don't feel like myself. Oh, well, you must have depression, you must have anxiety. Let's give you a pill on, give you an antidepressant or an anti-anxiety medication, and that's going to take care of it. And oftentimes it's a little more complex than that. I am an absolute firm believer in mental health medications and proper. I am not at all saying that that's a bad thing, but I think that we're seeing that perhaps other treatments could also be beneficial, even, cognitive behavioral therapy. I think some of it too is just a woman hearing that what they're going through is normal. And that they're not crazy, and that other women are going through this. I mean, I just yesterday had a consultation with a woman in her early 40s, and she said, I just don't feel like myself. I've never been depressed. I've never had such anxiety. I'm irritable. I'm reactive to my children, and I don't know what it is. And I said, well, probably a lot of it is perimenopause. And even just hearing that brings such relief to women.
Yeah. Like, okay, I'm not crazy. I'm not a psycho.
I'm not crazy.
I interviewed a therapist. It's been a couple months ago now, but we were talking about, like the ways that women feel when they get to like this age 40. And a lot of it is like, I am intolerant. I want to escape. I just want to get away, like all of the things. And, it's hormonal to find out that like, I'm not the only one who all of a sudden woke up one day and now feel like I'm in this life that I don't even recognize.
Right.
There are ways to get out of it. So Yeah. It's
Yeah,
good.
like I'm living in
Definitely
this
good to
body and
know.
I don't feel like myself. Like, who am I?
Yeah.
And I think also to make that even more complex, some of the metabolic changes that happen during
Hmm.
perimenopause, including weight gain and body composition changes, so weight redistribution, particularly mid-abdominal weight gain. Women come to me all the time saying that I'm eating the same, I'm working out the same, and my body is changing, and I feel like I can't stop it. And you feel out
Hmm.
of control. So now you're irritable, you're feeling depressed, you're feeling anxious. Now your body's changing, you're gaining weight, which causes this whole cascade. And especially for women, we tend to, I think that our body and our weight, we're very sensitive to those changes. And so you're just tackling all these things on that that they're a struggle and it's difficult.
Yeah.
And that's
Yeah.
why that I love Mary Claire Haver's word, the zone of chaos, because you just feel chaotic. And, other changes that we see, big time changes in sleep. So difficulty sleeping, joint pains, dry skin, hair changes, libido is huge. Changes in libido, low libido, decline in sexual function. So even the ability to have satisfying sexual encounters, the ability to reach orgasm becomes difficult. There's about 70 symptoms that have been identified as correlated with perimenopause and menopause. Things that you would never even think of. Dental
Yeah.
changes. We see dental health changing. Women start losing teeth, having more cavities during menopause. I mean, you name it, head to toe, our body changes,
Hmm.
and it can be challenging.
Yeah, definitely. So much good stuff that you said in there. So let's go back to like hormone replacement therapy as, I guess, like a way to address all of the things that you were just talking about. So something else that I learned that I didn't know is like how difficult it is to like do a blood test and get a good baseline for what are your hormones. It seems like, well, if it's all hormones, then just test it and figure it out and then fix it. So talk about why it's so hard to identify and how you go about like getting a patient onto a protocol that is going to alleviate some of these symptoms.
Sure. And that's a great question. And I get asked that question, especially about blood work all the time. Women like, I want to know where my hormones are.
Hmm.
So it is very difficult, especially during perimenopause, because of this. Remember what used to be really regular and cyclical? We could check your hormones and we know exactly what we're going to expect to find. But when we're in the zone of chaos, I can check your hormones today and it would look very different a few days from now. However, I still utilize lab testing to get an overall idea. There's a couple numbers that we look at. One of them is called FSH, follicle stimulating hormone. And that's a signal that comes from our brain to our ovaries to tell our ovaries to make hormones. As the ovaries are slowing down their hormone production, the brain, very smart brain, is saying, hey, I need more hormones. I need more hormones. So we see this FSH level rise. And then after menopause, it rises, and then it just stays high. It never goes down. But that's something that I like to look at in perimenopause just to get an overall idea of where we are. I also am a huge advocate for female appropriate testosterone therapy for women in perimenopause and menopause. So I will I always check a testosterone level on my women because that's typically one of the first hormones that I like to replace during the perimenopause transition. So we'll check a testosterone level, an FSH. I will include an estradiol, a progesterone, and then I also look at other things. We want to look at your thyroid. We want to look at some vitamin levels. Make sure that we're also not missing something else that could be causing these symptoms. I also just look at general health laboratory tests. I worked in primary care as a nurse practitioner for 5 years, so I am all about preventative screenings. So I do a pretty thorough workup with my patients because I'm comfortable in that space because I did primary care. So looking at cholesterol, liver, kidneys, electrolytes, and blood count. And so I take a pretty good comprehensive view of overall health and then include the hormones in that. And based upon what we find, just have a really informed discussion with my women about what our findings are, what this looks like, and then what I can do to help. I do say, obviously, healthy lifestyle is the foundation of health. So I don't discount everything. Hormones aren't the only answer. In other words,
Hmm.
I look really holistically at someone's lifestyle, all the lifestyle components that we can do to maximize. And then we sort of begin potential hormone discussions, which I can get very granular with if you want me to. And I love talking about it. I talk numbers, I talk treatments. I mean, whatever you want me to talk about, I'm happy to talk about.
Let's go in that direction a little bit, and then I would like to back up, because I do think that it's important for women to know what are these lifestyle things that we can do. Like if somebody's listening and they're like not quite ready to go see someone, or there's symptoms, they don't think they're that bad, but they want to know, like, what can I be doing to set myself up for success or mitigate as much as possible? So I'm good to get granular, and then maybe let's like pull it back a little bit.
Cool. So I will say with lifestyle, I'd say modifications or things that we want to aim for. I cannot stress enough the importance of exercise. And in particular, as we get into perimenopause, moving away from these high impact, high stress, high cortisol producing exercises and moving into strength training. It is something you have to think longevity for your body. You know, what do you want your body in 20 years, 30 years, 40 years? How do we want to show up for her? And we need to be strong for her. We need to have strong bones for her. We need to have strong muscles for her. So I am unbelievably passionate about strength training, resistance training, weightlifting for women, especially in perimenopause, and then preparing for that menopause transition, and then preparing for longevity. So that's number one for me. Being really mindful of our sleep, because it becomes so difficult during perimenopause. So, maybe even utilizing a sleep tracker if you need to get information on your sleep, finding some supplements, melatonin, magnesium, sleep hygiene, turning our phones off well before that time that we're trying to go to sleep, creating a sleep schedule. And sometimes women need help for sleep with either medications, or even sometimes we'll get into this, but progesterone is something that affects our sleep. So sleep hygiene, mental health, because as we just discussed earlier, and whatever that looks like for an individual, that is something that brings them peace and relief, whatever it might be. Everyone's so different, but prioritizing your mental health. I think those would be my top strength training, prioritizing sleep, prioritizing mental health, and then alcohol. We have to have that discussion about alcohol, because what we used to be able to do in our 20s and 30s, we can't do anymore in our 40s. And you're smiling, probably, baby, you've had a similar experience.
Yes. Absolutely. I actually said this to my husband yesterday. Like, I think it was Dr. Mary Claire in the Huberman episode. She said, now if I have a glass of wine, I'm choosing wine over sleep. And yes. It is like, it is crazy. And it's like, I went to bed one day and I could tolerate alcohol just fine. And I woke up the next day and I no longer could. And it's like anything. It's a beer, it's a glass of wine, it's anything. My sleep is horrendous. And it takes me, it's like, you used to say like a hangover in your 20s felt very different from in your 30s. And now it's like a hangover in my 20s feels like a glass of wine in my 40s. And I'm like in this stage right now where I'm like, it is just not worth it. Like, I'm 43 and I have a toddler. Like, I already have bad sleep, because of that. Like, I can't have bad sleep because of wine also. So,
yep.
It is really like exchanging your now for your future, really.
It really is. And we also know too, and I talk a lot about this to my women in the 20s, excess alcohol intake will accelerate your ovarian aging, full stop. Mm-hmm. Smoking, alcohol intake will cause those ovaries to age faster. And so, and then we fast forward into our 40s, and we just can't handle it. You sacrifice, you're going to give something up. So exactly. Again, I'm all about balance, enjoy your life, have fun if it's not, but for the 80-20 rule, right? 80% of the time, be kind to your body. She'll be kind back to you. Yeah. Just 20%, if you want to have fun, you want to do something, if it makes you feel good, you're having a celebration, go for it. But just know you're probably going to pay for it.
Yeah. Yeah.
And so alcohol, and then of course smoke. I mean, I think people are pretty aware of smoking these days, of the detrimental effects, but even more so during perimenopause and menopause. Yeah. So I think those are kind of the basics of lifestyle components that can help prepare you and keep you as good as you can be during that transition, in preparation for then the menopause transition.
Yeah. What about nutrition and supplementation? What do we need to know, or what needs to change during this period of our life?
Yep. So protein intake becomes even more important as we age. And that ties into this strength training, muscle, having adequate muscle mass, that becomes even more important. So I'm a big advocate on high protein intake. I have really lofty goals for my patients, and not everyone, has to make sure it's appropriate for your health, for your kidney health, for your lifestyle. But I have very lofty protein goals. And those are based on, there's an incredible longevity doctor called Dr. Gabriella Lyon, who is changing the face of longevity and really championing what is called muscle-centric medicine. She's an incredible women's health advocate, but she is, again, having these lofty goals that I pass down to my patients of aiming for about 1 gram of protein, 0.8 to 1 gram of protein per pound of ideal body weight. So if your ideal body weight's 150 pounds, aiming for about 120 to 150 grams of protein a day. It's a lot of protein. Most women aren't getting that. So protein intake, obviously fiber. We need our gut to be healthy. So having good adequate amount of fiber intake. And then when it comes to supplementation, going back to what we look at in lab values, I always look at a vitamin D level. I look at B12 and folate. I'm not a huge proponent of having to take multiple supplements. I have a toolkit that I like to it's what works for me, what we have good literature about. So I pass on to my patients. Most women are going to need vitamin D supplementation. We're just not getting enough from the sun. We protect our skin. We're not absorbing it enough in our gut and the foods that we eat. So vitamin D supplementation. I love creatine. So creatine is something that we know is great for muscle synthesis, but it's also incredible for cognitive health. And we're seeing these benefits for women in the longevity space of using creatine. I aim for about 3 grams. 5 would be the upper limit I usually recommend for women, but starting at like 3 grams and maybe even only a couple times a week so that your gut gets used to it and your body's handling it fine. Creatine monohydrate. Collagen powder. So hydrolyzed collagen is great for our joint health and our tissue. So collagen, creatine, vitamin D, and then I work other things in based on individual, patients' individual needs and things that are important. But protein is my protein, fiber, creatine, collagen, vitamin D, maybe some methylated B vitamins. Magnesium glycinate is excellent for all the different types of magnesium. I like magnesium glycinate. It's kind of has a muscle relaxing component to it. I strength train really hard. So for me, magnesium glycinate is good. Can be really helpful for sleep. Melatonin, melatonin it's not a sleep aid that it's going to put you to sleep and cause you to stay asleep. It's something that contributes to just regulating that circadian rhythm in our brain. So if my patients are really struggling for sleep, I'll put together a little cocktail for them and say, maybe take a little melatonin, a little magnesium at nighttime. So those are probably the overview of like my top supplements that I like to recommend.
Yeah. So I think Dr. Lyon was mentioned in some episode that you had me listen to. So now I'm listening to more on her. And I mean, it is so fascinating. And you've probably seen this because your algorithm on social media is probably similar to mine, but you've probably seen the meme that is like, I'm sorry, I can't do that. I have to eat a bunch of protein today.
Yes, somebody just sent me that.
I personally, I have always prioritized protein. So I don't think that I have the same challenges that a lot of women do. Like I have protein at every meal. I always have, but I know that is like so challenging, even for like friends and family who, maybe 2 out of 3 of their meals a day don't have any protein in it. So what do you advise to your patients who are like, they're going for maybe 30 grams of protein a day instead of like 30 to 50 per meal? How can they make some adjustments to that?
Yeah. And it's true. I think women on average get maybe 50 grams a day. It's just, it's not a lot. So, I personally I take 1 protein shake a day because it helps me. So I'll just give you a quick overview of my 46-year-old schedule.
Yeah.
I'm up early.
Let's hear it.
I'm up at 5. I do a little creatine before my workout, some branched chain amino acids. I go to gym. I lift weights 4 to 5 days a week, really early in the morning. So that's when I have to fit it in. And then I come home and I make myself like a power protein shake. So I use I like whey protein. It's a complete amino acid profile. I use a whey protein powder. I add about a half a cup or so of non-fat Greek yogurt, which is loaded with protein. I put my collagen powder in there. I put some fiber powder. I put blueberries, blackberries. I like a macadamia milk or an almond milk, something. And I'm getting about 50 grams of protein right there, just in my morning shake. Maybe 40 to 50, depends on how much of my protein I throw. But
heavy-handed
40
you
to
are,
50 grams right there, that's a great start to your day. And that's right after my workout. I like to feed my muscles that way protein right after my workout. And then I'm at my office most of the day. And at my office, I keep low-fat cottage cheese. I keep boiled eggs. I have a $12 Amazon. The best $12 I've ever spent in my life is a boiled egg maker on Amazon. It's like you just put the eggs in, put a timer, it boils them for you, because egg whites are a great source of protein. So I keep those little snacks at work with me throughout the day. So I'll just have a few bites of cottage cheese or some couple boiled eggs. And then at lunch, I make sure to have something. I personally eat animal protein. I know not everyone does. So if you don't eat animal protein, beans and rice make a complete amino acid profile, legumes. So for me, then I'll have some sort of protein and whatever I have. If I'm eating out, or if I'm eating at the office, some sort of protein for lunch. And now I'm already at probably 110 grams for the day, 110, 120. And then at dinner, I have protein with dinner. So, it can be done. You just have to be intentional and be aware. So chicken breast about the size of your palm is roughly 30 grams of protein. So if you're having, like I said, chicken or a cup of even chicken and some beans or something, you're getting even extra protein that way. So it's just having protein snacks around and being mindful when you're choosing your meals to choose something with protein in it.
Yeah. And why is protein so important, especially for women this age?
I mean, I think that the reason is muscle synthesis, the ability to put on muscle. The quality and quantity of our skeletal muscle tissue is directly tied to our longevity. And as women go through the menopause transition, our bone density, because of the loss of estrogen, decreases, and we are at much higher risk for osteopenia and osteoporosis. And having adequate skeletal muscle tissue is absolutely crucial. And in order to have that skeletal muscle tissue, we've got to have protein to synthesize muscle. So I mean, that's the simplified version of excuse me. That's my version, and the simplified version of why we need protein. We need to build muscle. We need to have strong bones and strong muscles.
Yeah. So back to the hormone replacement therapy, and we were kind of going down the path of symptoms and hormone replacement therapy. So what about how that relates to, you mentioned like the visceral fat that women start to gain during that time? What does that look like? How can women address that? Is it something that we just accept because it's kind of what happens to us? Or I know it's something that is like, you even mentioned the emotional toll that it takes on women. Like, how do we handle that? And really, I guess, why is that fat so harmful to us?
Right. So we see visceral fat. So we'll define what visceral fat is. Visceral fat is the fat that's wrapped around our organs inside, the fat that we don't see. Subcutaneous fat is what we see when our clothes don't fit right. We see it in our arms. We see that's subcutaneous fat. But visceral fat is inside, wrapped around our organs, and that is what long-term having excess visceral fat leads to insulin resistance. In insulin resistance becoming the hallmark of diabetes. Cholesterol derangement. So we see cholesterol markers elevating, which then puts us at higher risk for cardiovascular disease. So before perimenopause, we, on average, a healthy average woman will have about 7 to 8% visceral fat. And we see this marked jump during this hormonal change time up to into the 20s with really no change in what you've been doing. And so that's why I think we just have to bring this awareness to the fact that this is happening because of some hormonal changes. We're going to have to make some lifestyle adjustments, prioritizing the protein, being more mindful of what we're doing, increasing that strength training. And then one of the reasons for this change comes a little bit from the fact that testosterone levels begin declining big time in perimenopause. So women often think of testosterone as just a male hormone. We produce a lot of testosterone throughout our lifespan. Our ovaries produce testosterone. Our adrenal glands produce precursors to testosterone that convert to testosterone. Testosterone is incredibly important for women, and it's incredibly important for women's metabolic health. The ability to burn fat efficiently like we're supposed to, the ability to put on lean muscle tissue, right? The more lean muscle that we have, the better our metabolism functions. So that's why when we're getting in now a little bit into the hormone discussion, testosterone is most of the time one of the first hormones that I recommend to start giving women during perimenopause. So we'll check that level before. And I have the lab gives this reference range for women of what is normal. And that says anywhere from, say, 2 upwards of 45 or 50. And I literally have seen women come to me with a testosterone of 3. I mean, nothing in the basement. And they're tired. They're gaining weight in the midsection. They're trying to work. They can't get through their workouts, can't put on a muscle. So testosterone replacement, when done safely and appropriately, can be incredibly beneficial to women. We see reduced depression scores with testosterone use. We see, of course, improvements in libido. And I say this, the libido part with testosterone, with a grain of salt, because really for women, libido is so complex and it's really an emotion. So, just giving a woman testosterone isn't going to make her, want to hang from the chandeliers like maybe she wants to, but it's again part of the toolbox. But testosterone for women can be very helpful, can help with if you're having night sweats, can help you sleep a little bit better, and just overall the health benefits. It protects our brain, protects our bones, protects our breast tissue. Testosterone protects our breast tissue. So that's something that I almost always, for a woman who's really going through it, I will start testosterone replacement. That's personally for me. I started on testosterone about 1.5 years ago, and it changed my life. I had been waking up in pools of sweat at night. I was having terrible night sweats. I mean, waking up drenched in the bed, drenched.
Wow.
And I had been going through some mood changes, definitely libido changes, body changes. So for me, testosterone was absolutely life-changing and really, really helpful for me. So I usually I'll talk with women about the benefits of testosterone therapy. And then sometimes we do need to utilize some progesterone during perimenopause as well. And typically during that time, I will use it in the second half of the cycle. So our cycles are typically about, 28 to 30 days. That varies for everyone. But taking progesterone in what is called the luteal phase, or the second phase of our menstrual cycle, can be really helpful to help with sleep, to help offset some of the more severe PMS symptoms that can happen. And so those are two of the things in particular for perimenopause that I find helpful for my patients and obviously for myself.
This is kind of a different question. I think of women my age who may or may not be going through perimenopause yet. We may be having some symptoms, but we're not really sure. But we're all still on birth control. So, I personally have an IUD. I was talking to some of my friends over the past week or so. Some people are still on the pill. Some have been on fertility treatments for a long time. And so they've been on hormones. Is there a need to kind of stop that and get to baseline to see where are we and what's going on, or can you figure out where are you and what's going on without having to strip away what you've been doing?
Well, first of all, if you are still ovulating and you haven't gone through menopause, you can still get pregnant. So for pregnancy prevention, yes, absolutely. I will say personally, I love IUDs during perimenopause, and then even into the menopause transition, and even after. IUDs are excellent ways of preventing pregnancy. The combined oral contraceptive pills can be really helpful for people who are struggling with really erratic or heavy or dysfunctional menstrual bleeding because of this chaos. So, we don't have to just stop something to get this baseline. We can typically work around what we see in the lab results, knowing if you're on some sort of contraceptive. The oral contraceptive pills, they do suppress ovulation. So when we look at lab results of FSH and estrogen and progesterone, we're not getting the most accurate look at that, but I can get a good look at testosterone still. And then an IUD, we can still get a good look at hormone levels even with that. And I do tell my women, they think they're far beyond, being able to get pregnant. Absolutely not. If you haven't gone through that menopause transition, you can ovulate 1 month. It's more difficult, absolutely, to get pregnant. But so no, the short of it is no, you don't have, if something's working for you and it's working well, we can do other things to help. And we know when we're looking at that, I just look through that lens of knowing what it is that you're taking. Back to that, the IUD, it's a great tool, and it's a great form of not only contraceptive, but it's a great form of really helping to level out that what can potentially become dysfunctional uterine bleeding because of the hormonal chaos. So I'm planning mine out. I think I'm on my third one. I'm I've got this one, then I'll be 52. I can get one, and give me this 59. I'm planning all my and the progesterone contain, like Mirena, the IUDs that contain progesterone, when we get into the menopause transition and we need to start talking about estrogen replacement, those the IUD is offers protection to our uterus when we're taking progesterone. So for some women who progesterone makes them very sleepy or they just can't tolerate it, I'll send them to their gynecologist to get a progesterone containing IUD because it offers that uterine protection without having to take the oral progesterone.
Nice. Nice. A couple of other kind of off the wall questions. So I know that you work with women, but you also work with men. So in this like midlife change, do you recommend kind of the same like nutrition, supplemental exercise routine to men also?
Absolutely. So women, we go through menopause and men go through what's called andropause. Really, men their testosterone levels start declining sometimes even in the 30s. And we're seeing much earlier levels of low testosterone in men than we ever had. Our life, then so much is just due to lifestyle and what we call epigenetic changes, meaning really environmental assaults that are occurring to us all around us all the time. We live in a world of assault, and it's causing we're constantly exposed to these endocrine disruptors. So even men are struggling with proper hormone production and fertility issues at a young age. So absolutely, I recommend the same, lifestyle modifications and recommendations for men. And then I'm glad you brought up men because actually my partner, we've been together 8 years, so he's been through all this with me and he hears me talk about it all the time. He said, you need to have a course for men. Men need to know what women are going through. And
Yes.
tell the men, go to your appointment with an appointment with your wife, with your girlfriend, with your person, because he now has such a different understanding of what women go through than he ever did before because of our being in a relationship with me. It's funny because he's now even helping his friends saying, oh, I know what that is. It's cute, but he really brought that to my attention that men need to be educated as well as to what it is that women are going through because it's tough. It's tough. And so, yeah, absolutely. Men and women alike.
Yeah, lots of changes. So my next question actually was going to be about endocrine disruptors. So this is something that I am like very aware of and have been aware of for a long time, but I think that a lot of people are not. So can you talk about like what is an endocrine disruptor? What are all of these like things in our environment that are assaulting us and what can we do really in our own personal space to really try to like control as much of that as we can?
Yeah. So, we live in a toxic world and we're going to continue live. We can't get around it. So, I always preface this conversation with it's not meant to bring fear and cause anxiety about what it is because some of it you just can't avoid. Right. But, processed foods, ultra processed foods, I think are one of the largest sources of these forever chemicals, microplastics, even in all the things that are in endocrine disruptors. Our food sourcing is poor, period. Full stop. We have done ourselves such a disservice. And I think in our country in particular, our food sourcing is just terrible. So processed foods, ultra processed foods are absolutely wreaking havoc on our endocrine system. And I think we're going to see more and more and more of this coming out, especially as next generations coming up. I was listening to, I think it was a Huberman podcast on microplastics. And this was shocking. He said that they are finding forever chemicals and microplastics in the meconium, the first stools of babies after mothers have given birth. So that means even in utero, babies are being exposed to these endocrine disruptors. But plastics, microplastics, ultra processed foods, chemicals that we're putting onto our body. I have a daughter who's 20 and she loves all the smell goods, the candles, the lotions, and I finally I said, daughter, I think you have to take a little deeper look into what you're putting on your skin because it's absorbing what you're putting into your air. These candles, we're all seeing these as endocrine disruptors. It's just, we have to be mindful of what we're putting in our body and what we're putting on our skin and what's in our environment. And again, we're never going to be away from it all. It's just the world we live in. But if we can take small steps to avoid some of these major offenders, in the last year or so, I started in particular because I do eat animal meat, and I started ordering from a farm, this place called Wild Pastures. And I get my meat delivered once a month from this farm that it comes frozen. And I because they have pasture raised, pasture finished, grass fed. I love the ethos of how they farm and what they do. And so just little things that I do, making sure to have good water filters on your water at home.
Mm-hmm.
I personally, I don't drink out of plastic water bottles. Again, I'm a reasonable human, so I'm not a tyrant, but for the most part, the things that I do that are the biggest portions of what I consume on a daily basis, I try as much as possible to be clean, to do a clean, just make good choices on those things. Because again, it's that 80-20 rule, right? Like what we're exposed to kind of 80% of the time should be as good as it can be. And then we leave that other 20% for just life, because life happens and we're not always going to be able to be perfect in what we put in our bodies.
Yeah. I mean, I'm sure you're like me. We grew up in the Bath and Body Works era, the Victoria's Secret love spell era.
Yeah.
And, and now it's like, I wouldn't even let those products in my house now. But I think that that's not like the most widely known thing. And I know like friends of mine who have struggled with infertility, I know like their doctors have immediately told them like, here's what you need to do. But I wish that, that was something that was more widely talked about, like household cleaning products, candles, lotions, all of these things. I became aware of this a long time ago, but really, I think not obsessive, like practical about it when I got pregnant, because I'm just like, I have this opportunity to do this differently than I've been handling my own life, or, better, do better type of thing. And so I've really changed like all the products we use. I know a lot of what you're saying, like water filters, like your refrigerator water filter is not enough, like your tap water is not free of these microplastics. Air purifiers, I think, are really important. There's a whole host of them. The one that I have so much room for improvement on is drinking out of plastic water bottles. Like 2025, like goal of mine, but every little bit helps, and I think like as you run out of products, like it doesn't have to be something that you just like overhaul all at once, but as you run out of something, replace it. And I think the EWG, the Environmental Working Group, is like where I get the majority of my information on everything. And, we live in Florida, so sunscreen, all of the things, they matter.
Yeah.
They do wreak havoc on our bodies that we're like unaware of. And then we're treating these symptoms with drugs that are not really solving the problem. They're just masking the symptoms. So
yeah, I love that. I'd love to hear, you sound you probably even are more knowledgeable than I am on that. I'd love to hear, I mean, even maybe not now, but that'd be a cool podcast. I'd love to hear from you about how you've made those changes in your, in your home and for your family and for your daughter. And, because we're in an endocrine disrupted world. And what I try to explain to patients is what's happened is that it's really changed the way our genes express themselves. And so what used to, so let's take appetite and satiety. When what should happen is that we eat and our stomach gets full. It sends a signal to our brain to turn off the hunger signal, and then we should be satisfied and just move on. But we've really created this dysfunctional signaling between our gut hormones and our brain even, and we don't feel that signaling doesn't work the same as it used to. In addition, because of these endocrine disruptors and epigenetic changes, we're storing fat accumulation like never before. I mean, we didn't used to store fat like we do now. And so much of that is due to these literally changes in the way our genes are signal each other, express these expressions that come. And I have so much empathy for my patients who come to me, especially. I do a lot with medically supervised weight loss as well. And I tell my patients, this isn't your choice. It isn't your fault. If it was as easy as eat less and work out more, we wouldn't have the obesity epidemic that we have in this country. We have altered our gene expression when it comes to our metabolism because of really these endocrine disruptors. We've literally, that's why we have this problem. Obviously, it's more complex than that, but I really have a lot of empathy for my patients who are struggling, who are trying to do the right things and still struggling with their weight. And, we're really fighting this uphill battle. So I love that you've made those changes in your life as well. And your daughter will be better off for it.
Yeah. And it's, it's not easy. And I think I have spent a lot of years and a lot of time researching. It is something you really have to like learn about and invest in the knowledge, to know what to look for. So I understand like it can be very overwhelming, and, we're all busy. Like life is also, we haven't even talked about stress as a part of all of this, but like, life is going on at the same time. So that's really, one of my big goals with the podcast is just to bring awareness about these things, and then to be a resource for people who want to learn more. Something
I'd
else,
love
I'm
to hear
sure.
like products that you
Yeah.
use and what because I would love to hear about that, all that from you,
Yeah.
kind of your top products that you've been
Well,
able to replace or change in and out for things.
yeah. So my favorite brand that I use for everything, and I'll mention them because I do have like a partnership with them, is Attitude. I'm not sure if you're familiar with Attitude, but they're all EWG verified products. And I use that for everything. I use it for hand soap. That's my daughter's like bath stuff, toothpaste, like bathroom cleaner, toilet bowl cleaner, stuff to mop the floor with. I don't use any candles anymore. I do follow like some low tox living people on Instagram who will sometimes say like, here's what you should use. But for me, I just decided like, I'm just not going to use it. Zero water filters. There are some things around that I would like to upgrade, like water filtration, like under sink in the refrigerator. Kind of haven't gotten around to that yet. But to your point about not drinking out of plastics, like stainless steel. I still need to like replace cookware. It's everywhere. And, there's only so much you can do at one time. But I think the more you know, the better you can do. I will say, I think there are two areas that we could definitely as a family improve on. One is plastic water bottles for a ton of reasons, but we way overuse those. And the second one is wearing our shoes in the house. That is something that I would like to stop us from doing. It just seems like easier said than done. But, when you think about, especially like here in Florida, like we're walking in the grass and we're walking everywhere. Everything around us is treated. Everything has chemicals on it. And you walk those right in your house and put them all on your floor, on your carpet. And then, you have little kids walking around on that. And so I could talk about this forever too.
I can tell. I love it.
It's so important. And it's a part, you're talking about like genes and all of that and processed foods. And I know like there's so much news right now about food dyes and additives. And there's just so many layers to this problem. And, I can't remember. I was just listening to a podcast recently, and it's like, like 75% of Americans are overweight and 51% of our youth are overweight. And that stat just breaks my heart, because we are just setting this generation up for like oppression, really, when you think about it. Like they are going to be tied to the medical system. They are going to be tied to these drugs. I should stop at some point, but it breaks my heart. If we would talk about our youth, and instead of being like, oh, well, they're chubby or they're holding on to some baby weight. And like, what if we were like, well, actually, like they're all probably pre-diabetic. Like how differently would us as parents like treat our children if that's how we thought of them? And, I have a lot of like empathy, as you're saying, because I think that there's so much misinformation and so much pressure and so much like, I could go on and on and on about like food in schools and what kids are eating and exposed to, but we'll stop it at that.
We'll stop it. But yeah, I'm with you. It's point where we are living in, we just live in a toxic world. And really, I think we're being poisoned. And I say that loosely, but we really, it is. And it's very sad. But that's what, I like what you're saying is that, like you said, you don't have to throw everything out and start all over. One thing at a time. As you run out of this, replace it with something that resonates, that's better. Just replace it with something that's a little less toxic. And each time, throw this out, replace it. I even tell my patients that with, say, supplements in the office. They'll ask, I don't hone in on a particular brand, but whenever you have it, use what you have, but just don't buy that one again. We'll just replace it with this. And I love that. I'm going to check out Attitude. I haven't heard of their products. So love that. Love those. Love that recommendation. Can't wait to look at that.
Yes.
But yeah, and I think this.
Yeah.
Oh, yay. Please put the link. Please put the links. I want the link.
Yeah.
But, I think this also, then we can also tie this back to this hormonal cycle and even tying it back into, let's say your daughter, for example, you want to set her up for the most success and the healthiest life that she can have, because then that will tie into also having the healthiest perimenopause and menopause transition that she can have, right? We're seeing even earlier ages of menopause and earlier ages of puberty and earlier ages of menopause because of these these things that accelerate this ovarian aging. So it all really does, it's all encompassing, and it's having to take this holistic view of everything. So even what we're just talking about now ties back into us as women in this time and navigating this time, that giving ourselves the best tools that we can give ourselves and helping our body as much as we can instead of hurting our body. And it's, I think it goes to even the whole premise of your podcast. It's how can we be true to self and living this authentic life, showing up for ourselves the best that we can. It has to be full circle. It has to be in every arena of our life.
Yep. And knowing it will pay off. The things that you're doing now and getting up early in the morning, and you've probably been doing it so long, you can't imagine your life without that, because you know and see and feel all the benefits. But when you're not living in that, it's hard. It's a hard transition to get into. It's a hard pattern to break, but the things they're so worth it because they just pay so many dividends for a really long time. And I think, we're women who have families and goals, and we want to be around to be with our families and to meet those goals and to live our dreams. And we have control over a lot of the things that will ensure that we get to do that. And so, everything you shared today was amazing. We'll probably have to have you come back on, and we can have part 2 or 3 or 4.
Yeah, I know there's so much. There's so much. But I think it was a good, I hope that it was just a good, basic understanding so that women can understand that what they're going through is real, and that their suffering is real, and that struggle is real, but there are resources, there are things that we can do. And I think sometimes I just think the awareness, when someone validates what you're feeling is really, that alone can give you a breath of fresh air and help you get up one more day to say, okay, it's about what I'm going through is real, and it's hormonal. It's not just me being crazy. I mean, that alone to me is such a powerful piece, and why I tell that to my women all the time when I see them. I said, it is real. What you're going through is real. And I think that's just the first step to feeling a little bit better.
Yeah, I completely agree with that. It's a big, big thing to know that you're not the only one in a lot of ways. Yeah, this information has been great. I do want to give you an opportunity to talk about a little bit more what you do. How can people find you? How can they work with you if they want to have an appointment? I know you see people virtually. We talked about that. So tell us all about the ways that people can find and connect with you.
Well, thanks. So, my clinic is called Medical Anti-Aging. We're in Fort Lauderdale, Florida. I am licensed to see patients currently in Florida, and then I'm working on getting my license. We're working really hard to get licensed in other states, but I can see patients virtually from all over Florida or in clinic here. Our website is medicalantiaging.com. And then I'm really working hard to put out some good women's midlife health education on my Instagram, KM Health Collective. And I hope that I can just empower women through that educational piece. I'm starting to work on different, collaborations. Again, just bringing awareness and education to women. But I do virtual consults and through the Medical Anti-Aging.
Yeah. Well, I need to be signed up for a consult, signed up for some blood work, signed up for all the things.
Well, you got the direct line here, so we're good.
Yes. Yeah.
And I'm just so ready. Grateful. Yeah, thank you so much for having me, Kelley. I love what you're doing, and I want to also be able to support you in any way. And I think this is a really amazing time for us as women navigating midlife. Any way that we can do to help each other and support each other is really important. And I'm really grateful for what you're doing for your listeners.
Well, thank you. Thank you. And right back at you. I think you're doing very important work. I would encourage everybody listening, go find Kelley, follow her and support her, because I think the more women know this, the more we can help people who are really going through it. And I think that's really important. Help people feel more like themselves, more like they want to feel, and kind of be able to go out and conquer the world again. So
this is not the end. And I tell women this is just our next phase. It's not the end. It's just our next phase. We're transitioning into a really cool phase.
And a great one, right?
Yeah.
A great one.
Absolutely great one.
Should be able to fully enjoy. So thank you for joining and sharing all of your expertise. This was great. And I know everyone's going to love it.
Love it. Thank you so much, Kelley. Appreciate it.
Thanks. Thank you all so much for listening to this episode. It's truly an honor to help bring these conversations to you. I do have a couple of quick favors to ask of you. While you're listening to an episode, could you take a screenshot and post that to your Instagram stories and tag me at Life Intended Podcast? And just let me know what your favorite takeaways were or what you liked about the episode. It really helps me to learn more about what you love and want to see more of. And if you have a few extra minutes, if you'd go to iTunes or wherever you listen, I'd love it if you could leave me a rating and review. Ratings and reviews are one of the best ways new listeners can find the show, and I'd love nothing more to grow this and help more people live a life intended. See you again here next week.